Hi, I'm Holly.
And I'm Charisse.
And welcome to Ask Mom. Well, our kids are back in school, so that means we get to start off with a new season of videos. And so we thought we'd start off a new season of videos with an old video.
Because that's always refreshing. It's refreshing.
We have one about visiting your gynecologist that is extremely poor quality, although quite funny.
Yeah, I did, yeah.
When do you first go to the gynecologist, Charisse? Tell me.
When your insurance covers it, generally.
Sexually active is one of the factors that a lot of girls go for because they become sexually active and you know, they may have made a decision they're going to stay that way, and so they want to be on the pill, and so you need to go to your gynecologist to have that happen.
Right.
Could be that you have cycles. You could be very young. You could be 13, you have cycles, but maybe they're extremely painful cycles, and you want to talk to him about cramping or extremely heavy periods or whatever. So your gynecologist is the one you go to with any issues that you have with your reproductive system, basically.
Right. And if you don't go before then, you need to go by at least the time that you're 21.
Mm-hmm. And mainly because by then, technically, you're an adult, and they want to know, well, what is healthy for you? And since they're looking inside of you and testing the cells and everything inside of you, they want to know, well, what's a baseline normal for her, so that if she comes back later with problems, we'll know how to deal with them.
Right.
Mm-hmm.
Mm-hmm. So what should you expect when you first... Well, here, how about this one? How about, like, there's male doctors and female doctors.
Right.
So I think the biggest thing that you need to do is go with what you feel comfortable with.
Rarely, if ever, should a doctor be alone with you in a room. Usually there's another person present, which is usually a nurse that he calls in as soon as he goes into the room with you.
Right.
And so basically you're going to go into the room when they call you in, and they're going to ask you to take off your clothes and put on a gown. He'll ask you to get up on the table. He'll usually have a conversation with you about, are you experiencing any problems? Is there any particular reason you came other than just having your annual checkup? And so you can discuss those things with him.
They'll ask a full history of, you know, when you started, what are your periods like? And that's, you know, when they get all their information.
Right. Keep track of your details. So he would always say, what's the first day of your last cycle? Mm-hmm. And I'd sit there and go, because that's a really hard thing to keep track of mentally if you haven't written it down. So it's a good idea to just keep track of what your cycles are like, particularly if you have questions, so you can go in prepared to ask.
Right.
What if you don't want to say a word to your doctor because you're kind of scared to bring up your issues? You could have your mom come in with you, tell your mom what you're worried about, and she could convey it. You could also just sit down and write out all the things you really want to know, all of your concerns, and then hand it to the nurse to put in the file when the doctor gets there, or hand it to the doctor, and then he can read through it and address whatever your concerns are, and you don't have to say, like, the word vagina out loud to him or something.
Well, I think that's a better idea to have it written down anyways. Like, I mean, you know, the easy questions they're going to ask you, when did your cycle last start? How long does your cycle last? Are there any abnormalities? I mean, those are all good things to have written down so that you're not like, well, I don't know, I don't remember. I mean, because the more information you can give your doctor, the better job they can do for you.
So you're going to put on your gown, you're going to have a case history, you're going to write down or express whatever your concerns are. And then the first thing they're going to have you do is lay down on the table, and the doctor's going to put up these two little metal things. They're like stirrups.
They call them stirrups.
They actually call them that, yes. And you're going to put your little feet into them. So I like to wear socks because I don't like cold metal on my bare feet. It's another thing to make me kind of feel nervous or edgy. I don't know. It's one of my own personal preferences. So you're going to have your little socked feet on in the stirrups, and you're going to feel uncomfortable because it doesn't matter how many times I go. That's a very vulnerable, uncomfortable position to be in.
So the next thing you'll hear your doctor say is slide down. That's when your bottom gets stuck to the paper and you slide down the table. Happens to everybody.
Yes. So if this is like the edge of the table, they're going to tell you to slide down so that your bottom is right at the very edge, because obviously he's going to need to use tools and instruments in order to be able to examine you. So usually what my doctor does first is a pelvic exam. Washes his hands, puts gloves on, puts lubricant on a couple of fingers, and then inserts the fingers into your vagina. And while these fingers are in your body, his hand is on top of your tummy, and he's feeling all around your whole uterus area, right?
And usually they're explaining this as they go. They're not just going to go, okay,
or yeah,
close your eyes. They're going to explain, especially if it's your first time.
The more you can try to relax the lower half of your body while you're going through this exam, the more comfortable it will be. So the next thing he's going to do is take a speculum, which if you've ever seen the salad tongs you use to scoop up salad that are connected, that kind of like crisscross over and then have like clampers like this. And so they will take those and they'll slide it in to your vagina and then open them up. And that gives him a clear, now it's not going like this. Okay, so you don't have to get scared. It's just a little, enough for a Q-tip. And so they have a very long Q-tip on a stick, right? A very long one. And he reaches back and he takes samples of cells. So the samples, that's not painful. In fact, I can never even feel anything. So they just sort of dab on the side and they dab around your cervix, and then they have a slide. They pull out the Q-tip and they rub it on this little slide, put it together, hands it to the nurse sends it off to a lab.
Right. And that is called a pap smear.
And that is called a pap smear. Very good. And what is a pap smear testing?
It's testing for normal cells or abnormal cells in your cervix.
Right. I know this is an uncomfortable thing to do, both emotionally and a little bit physically, but it will not be super painful, and it is necessary to protect you. It will detect cancers or infections, things like that a doctor...
At an earlier stage.
At an earlier stage, so that you can, if you're 16 or 20 and you don't want children right now, someday you might want them. So you want your body to be as healthy as it can be, so that you can have all those options as you get older.
Although we say it's not uncomfortable, which I haven't experienced uncomfortable, it may be uncomfortable for you. So the doctor will always ask through the exam, are you comfortable? Is everything okay?
So you've had your pelvic and your pap smear. About maybe a couple of weeks after you have it, the lab results should come back, and then I usually get a card in the mail that says your tests all proved that you are healthy and fine, or we need to schedule a follow-up appointment because we saw something that maybe looked curious to us and we want to investigate it further.
And so with that too, don't worry yourself, because sometimes they can be false positives on the test, so don't go into the whole tailspin of something must be horribly wrong with me. Just wait till you get all the follow-up tests done if you do have an abnormal pap smear.
Right, that's really wise, that's for sure. And so then the next thing that they usually do is a breast exam. So you continue to lay down on the table, although usually you get to scoot back and lay your head on the pillow, a little more comfortable. And he'll move your gown off to one side. And, we've done videos before on breast exams. So you can always go there and look at that video. You can go to our channel and type in breast exam and learn about what that's about. But basically, he moves the gown aside, and he just goes through a series of circular motions with his hand all the way to your nipple, feeling for any lumps that might feel unusual to him. And
honestly, they do it so fast that it's, if you're thinking, oh, that's not going to be comfortable, like, it is so fast and so professional.
Zero pain.
Yeah, and there's no pain. And then they'll ask you, do you do self-checks? You should, and if you have any questions at that point, well, is this the way I do a self-check? What am I looking for? Those are all good times to ask questions too.
I would say it's a 5 to 10 second abreast kind of thing. It is extremely fast. Altogether, I would say the exam is about 15 minutes. Is that your experience?
I would say so too. You might be in the office longer waiting and filling out paperwork, but your face-to-face time with the doctor is probably 15. They'll probably charge your insurance company an hour, but the face-to-face time is really 15 minutes.
Yeah. And you can choose to have someone in there with you. You can have like a mom or a friend or something like that in there with you if you want, or you can just be alone with the doctor and the nurse.
When we first, from our first video, there was one of the questions from one of the girls that said, will the doctor know if I've had sex by giving me a pelvic exam? And the answer is?
Probably not.
No.
Yeah, I doubt that. I mean, I guess maybe if you were older and you had had sex for a long time, it's possible maybe he could just see that things are more stretched out, perhaps. But I would say no.
Right.
Yeah.
So if you want to be able to talk to him or her about things like that, and you don't feel comfortable with your parent in the room, then you wouldn't have your parent in the room.
What if you have an appointment, you're ready to go in, and you start your period.
I would cancel and reschedule the appointment.
Mm-hmm. Particularly if you're on your early heavy days, if it's like you think you're going to be done by the time you have your appointment and it's just really, really light. I've gone in when it's really light and said, do you want to do it today or not? And they're like, as long as we know where you are in your cycle and it's light, no problem, we can do that. But there's an ongoing discussion on the video that we did previous about fear. And girls that feel very strongly about it or have very high anxiety that make comments about, you don't have to go, don't feel like you have to go. Okay, well, it's true. No one is going to put your arm behind your back and make you go. But from personal experience, I would not have children today had I not gone, because I was very rapidly growing cancer cells. So, and that was in my very early 20s. So, you know, it's so easy to do. It really doesn't take a long time. It really isn't a painful thing. Make the appointment and just go. If you have questions, feel free to leave them here in the comment section, or you can send us an email. Have a great day. I'm Holly.
I'm Charisse.